Dr. Michaela Lujan, and the dental manager, Amy Ward. Welcome to the show.
Thank you.
And welcome to Jackson.
Thank you. I'm very excited to be here.
Well, great. How do you like it so far?
I've been really enjoying it. It's been a nice transition for me, and I felt very welcomed here.
What was it about the Center for Family Health that attracted you?
Yeah, absolutely. It's a federally qualified health center, really focused on public health and public education, treating kids and adults of all different ages and different backgrounds with really quality dental care. I was really drawn to the fact that all of the providers have been really passionate about the center. They've stuck around and they're happy to be here in Jackson. I think that's really telling about a location.
Yeah, it's a great team. And last month we saluted everyone that works there during the National Health Center month.
Yes.
Or was it August? It was August.
August,
Yeah. And you're right, there are a number of providers that have been there for, I think, 30 years even. So that's great.
Yeah.
And you've had quite a road to becoming a pediatric dentist.
Yeah.
It's additional education after you get your dental degree, right?
Yes. Yeah.
Tell us about where you went to school and the path to being a pediatric dentist versus just a regular dentist.
Yeah, absolutely. I did my undergraduate degree from the University of South Carolina. And I was a student athlete there.
Go Gamecocks.
Go Gamecocks. And then I went over to UCLA, so I bounced back over to California, and I got my doctorate in dental surgery there. So I became a general dentist from UCLA. And then I did my specialty training at The Ohio State and Nationwide Children's Hospital, where I specialized in pediatrics and pediatric dental surgery.
Wow.
Yeah.
That's a lot.
Yeah.
And that's more because you decided after you became a dentist that you really wanted to specialize in kids.
Yeah.
Why?
Yeah, great question. Kids are just the most fun group of people to work with, but they're also the most vulnerable. They don't get to make the choices that affect their dental health every day sometimes, and so being able to provide them a positive dental experience and something that hopefully they can carry with them, give them a foundation to have a healthy mouth as an adult. I saw a lot of adult patients in dental school with severe dental anxiety, and after talking with most of them, it usually stemmed from something from their childhood. They were afraid of their dentist, or they had had a poor experience. And from that, they had a lifetime of hardship with their dental care.
Mm-hmm. Yes, scarred for life.
Yeah. And so my goal is to prevent that from happening, to never see that happen, and to catch them really young, provide a lot of preventative care. And then sometimes when we do have to provide more traditional restorative dentistry, doing it in a comfortable and fun environment that they can have a positive experience with.
Nice. Well, you got to like kids. Where I go to get my hair cut, there's a sign that says no one under 12.
Oh.
Yeah.
Oh no.
Well.
So I guess they don't like kids.
I guess not.
Do you like working with kids, Amy?
I like working with kids. Yeah. It's fun. Kids are great. They're, we have a chance to make a difference in their lives, starting at a really young age that they can carry into adulthood and change their smiles, change their life, change their attitude about themselves, and hopefully give them a whole health experience. Your mouth and your body are connected. You need to just make sure that you take care of everything. So it's good.
And you've got a whole team. Here's the photos of all of your dental team. And we mentioned how you have some people that have been there forever, like Dr. Ed Mattine, Dr. Charles Gerard, Dr. Jerry Booth, Dr. Don Powers. These are folks that had longstanding practices in Jackson and wanted to keep but they wanted to give back. Mm-hmm. And so it's great to see them part of the CFH team.
Mm-hmm. They've been a huge part of our team for a long time, and they are really connected to the community. It's been really nice to have them there and be able to kind of keep them going, and people are so grateful to see them. They remember them from private practice, and it's great.
Yeah, they do. Dr. Mattine, he had a patient that she loved him so much, she asked him out for dinner.
Aww.
Yes.
That's sweet.
Yeah, and he said, "Oh, I'm married, and Janine, she won't understand."
No.
So,
Right.
but what a great connection, really.
Yeah, absolutely.
So, what for pediatric dental care? What age do you start seeing kids, or what age should parents get their kids in?
Yeah, absolutely. We would love to see kids upon the eruption of their first tooth popping in. We'd be happy to see them, or at the latest 1 year. Some kiddos, their teeth don't come in right away, and that's okay, but we'd like to see them at 1 year. The main reason for that is prevention, like we've been talking about. In order to have a healthy mouth, we need to talk about the healthy habits that we can make at home. And so catching those things really early before we have cavities, and helping parents and families feel empowered to take care of their oral health and get their kids on the right trajectory really early is so important.
What do you say to parents that say, "Oh, well, these are baby teeth; they're going to fall out anyway. They don't need to worry about cavities or." You know.
So it's really important to keep those teeth in place. They're holding that place for the big teeth that come in, and painful teeth creates a lot of issues in kids' lives. They miss school because of it. They just aren't able to concentrate. Nobody wants to be up at night with a painful tooth, and keeping those healthy is important.
Yeah. All right, the dental anxiety. So what do you do? Like, you can't drug them, can you?
There's a time and a place for kind of everything, but we like to start with minimally invasive things. So playing games with kids, you can do a lot more with distraction and just really getting on a kid's level. We use laughing gas or nitrous oxide. That kind of sometimes helps kids feel a little bit more relaxed. We do that at the Center for Family Health a lot for our kids that have a little bit more dental anxiety. We also have a sensory room and closed door operatories where the lights can come down. We have noise canceling headphones, and
we also have phones that they can watch.
A
show, and really feel more comfortable and relaxed in the dental setting.
One thing that I think is really cool, you've been identified and recognized by the Delta Dental Foundation as a Center for Inclusive Dentistry. So what does that mean?
Yeah, that means that we're seeing kids of all ages and adults with varying degrees of ability to cooperate in the dental chair, or sometimes their first dental visit. We really want to encourage families to come even when they're afraid that this dental visit might not go well for them. We have so many tools in our tool chest that we can use to help see all these kids with varying capabilities to get their dental care, have a dental home.
And all these little kids grow up to be adults that need that care too, so
They do.
It's great to have the tools that we can use to help them get access to care too, which is much harder as they become adults.
Yeah.
Nonverbal kids, that's got to be a challenge.
Yeah, it can be, but the challenge is a good one. It's getting a kid to sit in the dental chair and learn something new is always really rewarding, and the smile on the parent's face is always worth it too.
Well, Amy, you work chairside as well as being manager of the dental clinic. You went to Northwest High School.
I did.
And then what?
U of M for dental hygiene school.
Nice.
Yeah.
So is there rivalry between?
No.
No.
Never.
To make an appointment, what's required? Can you be a brand new patient and start with you?
We're welcoming all kids into the clinic, so they can call our front desk to make that appointment. And then any patients with special needs, like our intellectual and developmentally disabled patients, they can call and make an appointment at the front desk too. So
You do a lot, both sides of the street, with pregnant women, new moms to be. How about with dentistry? Is that a special challenge at the clinic for moms to be that haven't maybe been going to the dentist?
It can be, and it can affect their pregnancy, and they need care too, and getting access to care so that they're not having abscesses and pain is really important. And sometimes getting in touch with them before their babies are born, it helps us talk to them about their needs, and then also their children's needs as they have them, and move on to that too. So it's helpful in many different aspects to kind of get them started on a good path.
What are the worst things kids are doing in terms of putting in their mouth foods and drinks that really impact their teeth negatively?
Yeah, great question. Honestly, the thing that I see cause cavities the most are the sugary drinks. So the juice, the lemonade, iced tea, the soda pop, and the milk, chocolate milk, strawberry milk. and it's not the occasional glass of juice with a meal, but the constant sipping. So carrying a sippy cup of juice all day long and kind of putting that sugar in our mouth every day. Obviously the candies and things like that, but I really think it's those sugary drinks
Yeah. Water works.
Water is the
Yes.
best.
It is.
Water whenever, juice just once a day, milk at meals. There you go.
Sounds like a great plan. Amy, and you guys take insurances. You also have qualifying programs, and you can help people with all of that too.
We do. We take most insurances. We take Medicaid, and we have people that can help with, like if you don't have insurance, to help you sign up for insurance, see if you qualify for that. We also have a sliding fee scale in our clinic, so if you qualify with income, there's about 4 or 5 different scales that you might qualify for that would help reduce your out-of-pocket costs.
All right, all you have to do is call. It's that easy to make an appointment.
It is.
And that's 748-5445. Great to have you here.
Thank you.
Thank you so much.
Yeah, nice to see you again,
Nice
Amy.
to see you again too.
And welcome to Jackson, Dr. Lujan.
Thank you so much, Bart. Appreciate
Dr.
it.
Michaela Lujan and Amy Ward from the Center for Family Health Dental Clinic.